Hi, I'm Ina Schoenberg with the USAID Advancing Nutrition Project. I thought it was great that you were able in this evaluation to look at participation versus non-participation. I was actually part of an impact, the qualitative part of an impact evaluation for the Uganda programs that you mentioned in the Karamoja region last year. And the data, I guess we were told that there could not, comparisons could not be done vis-a-vis participation and non-participation because they hadn't set up the sampling frames in order to say anything about it. So they refused to do the quantitative analysis on it. And I didn't know whether that was a cost factor or whether it was the fact that many of the activities actually had relatively small number, some of them had big numbers of participants, but many of them had very small numbers of participants. So I was wondering if you could comment on that. Like, is it a lot more expensive to set it up at the outset to be able to do that participation, non-participation? Because it was they were, out of the evaluation, you really couldn't say much about, certainly the nutritional impacts on the population overall, but as evaluators, we really felt that those who had participated had certainly seemed to have benefited. And the same, even though we couldn't statistically say it, it was clear that that just looking at what data we had, that when people were participating in multiple activities, it seemed like they were better off.
Right.
So can you speak to the cost and the pre-planning on that?
So, yeah, that's another one of these John things here. When we about a year before we actually were carrying out the end line, we started a dialogue with Mercy Corps and CARE about, can we really identify where all these activities are, which ones are more at the systems level, which one actually people are more participating in, and it was like pulling teeth. It was like pulling teeth. It was very difficult. We even sent people over there to work with the folks to try to find what was going on, And so we did the best we could. We had it at a fairly high aggregate level. And so then we just tried to build it into the community questionnaire and the household questionnaire in terms of asking people directly, did you participate in these things? Did you actually engage in these things? And trying to take into account all of the different things that this project was doing, because it was doing a lot of stuff. I don't know, you should see the great posters of all of the different things that they were doing. It was amazing, but I'm not sure that we captured everything we should have, that we needed to, simply because this was too hard to get.
Yeah.
So that's why at the very beginning of this, I'm saying from now on, whenever we do these impact evaluations, let's do a much better job of geographically locating where we're working, what we're doing, which interventions are going where, are people participating in it, or is it just a systems level change? So that it's much easier for us to evaluate whether the intervention mix is making a difference. So it's just, yeah.
And I can add to that. Hi, I'm Diana Bicon from IDEAL/Mercy Corps. And as Tim said, I was working on the PRIME project for the first 4 years of implementation. And I hear you. I think that we were trying to figure out what was the best way of trying to connect with the participants of the program. Extremely difficult for a markets approach, and PRIME was markets on steroids. I mean, even during the emergencies, we were trying to use the market actors that we were engaging with rather than at a household level. In those emergencies activities, it was much easier to be able to collect that information. But with a regular market activity, it was much more difficult. We had information, and I kept telling Tim, well, we're working in this zone. And Tim's like, okay, but what Kabele? What community? But we're working on this zone. And it would be like just back and forth, and it was almost impossible to get. So yes, so even for our annual surveys, we took a very similar approach to what Tim did in the evaluation, is basically asking participants who were they connecting with? what kind of market actor they were connecting in that zone, and that kind of gave us some idea of what activities they were engaging with. Because, and then you had to also train those market actors you were working with to be able to get information with who they were engaging, what pastoralists they were engaging with, for example, for a trader. And they had to learn how to keep those, if you will, those that information as well. We did this with traders, but we also did it with larger companies we were working with.
Karen?
Can I-
Yeah, I think it's a really good question, and I think from the qualitative side and the quantitative as well, we had to cast a very broad net, because a lot of our more traditional programs, you can go into a specific area that you know is being targeted, and people are very familiar with whatever agency it is that's working there. And in this case, we were, as you said, Deanna, we had names of people they were connecting with, organizations, types of activities, and then we were able to kind of triangulate, put all of that together, because no one would say, for the most part, we're working with Prime. But they could say, we're working with Mercy Corps, we're working with, CARE, whoever it was, in this capacity. So we had to put that together.
Yeah, I
Yep.
just wanted to.
Tiffany.
Oh, sorry.
I just wanted to add two comments to that. I mean, if you'll notice, the comparison wasn't participated versus non-participated. It was participated versus exposed. So that's a really important distinction to keep in mind. And then second, the missions can also facilitate this kind of geolocating of participation, exposure. So fast forward 5 years from the Prime baseline to the Kenya Prague baseline, where we worked directly with the missions GIS team that had really great information on where different partners were working, and were able to, I mean, maybe it's, nothing's perfect, and it maybe still isn't as granular as we'd like, but it's a heck of a lot better than where we were in 2012. So just to kind of speak to the importance of the partnership between the implementing partners and leveraging the mission's capacity and will to kind of get this information for their own purposes and for evaluation purposes as well.
Mark, did you want to say something?
Oh, yeah, just to follow up, the issue that you raised is a recurring one. And it's basically, we're encountering it now at Tango. We're actually working with Food for Peace, conducting their population-based quantitative survey, and then also conducting at the same time the qualitative evaluation. And we have the same tension between the quantitative and qualitative, because the qualitative evaluation team wants to know exactly what the kinds of information you're asking. And so, the issue is that the quantitative survey was designed to serve a different purpose, to get an overall estimate of the large population where, in broad terms, the projects are being implemented, and not to be able to compare between whatever we want to call participants, non-participants. And so that's a big challenge, but the reason is because that the quantitative survey was designed with a different purpose. Your question about the cost, it doesn't necessarily have to cost more to have a survey where you are actually able to compare participants and non-participants. The bigger challenge, I think, some of these other comments have already raised, it's the challenge of identifying, particularly when you're doing this before project activities start to take place, who are going to be the participants. So that's the bigger challenge that we face.
Thanks so much. This is Catherine Arnold with Save the Children. I was wondering if you could talk just a little bit more about the impact indicators that you used and what you saw from those. You mentioned the subjective indicator of self-reported ability to recover. You also mentioned the objective indicator of HFIAS. But then a couple slides also talked about wasting, and I was curious to know, did you see correlations between that self-reported ability to recover in HFIAS?
We did.
And also I wanted to know, did you have any sort of more objective indicators such as wasting, where it's not sort of being self-reported by the household, in sort of a questionnaire format?
So we, thankfully, the subjective measure of resilience and the realized resilience measure through the HFIAS actually align very nicely. So that was good to know. And then the other thing with regards to the wasting, even though we were trying very hard to include nutritional indicators in our analysis, one of the problems that we had with pastoralist groups in these areas is they didn't really know what the age of their kids were. And so stunting was a real problem because what we saw was age lumping, you know, where they, oh, my kid's 2 or my kid's 3 or my kid's 4. And even if you tried to use traditional Ethiopian calendars to try to get that a little bit more precise, it was daunting, to say the least. So that's why we relied more on the wasting measure, which doesn't rely on age. And I think that the telling thing that was really important there was when you look at people's access to health services and you saw it decline dramatically from the baseline to the end line, and we also, people's access to certain watering points and water access declined dramatically from baseline to end line. That has pretty good explanatory power for why that wasting really got worse in Jijiga, even though the food security access got better. So that just tells me that even though this was a comprehensive resilience program, and as she said, it was market focused on steroids, we need to be thinking about some of these other well-being things that have to be factored in when we talk about these resilience programs, because if you have all these positive gains in food security indicators, but then they're all lost because of these other factors, then you really haven't gained much.
Yeah, thanks, Tim. I just wanted to add to that, because I think one of the things that we picked up in the Borana region and the qualitative data set were several reports around trauma, the experience of trauma, suicide, some really troubling findings. And so just the extent to which programs can simultaneously be linking up with providers of psychosocial support when these crises get really hard, that was definitely something that we picked up.
Tom?
Yeah, a couple things just to follow up on. I think it's really interesting. I know the question you raised, we've seen this again and again with regard to sampling, but I think it's relevant to what you spoke to earlier on, Tim, of different resilience measurement activities for different purposes, right? So by that, yeah, the sampling question is obviously difficult, especially in instances where you want to have both treatment and control group. Mark, you can speak to how we've tried to do this through the L4R, the Livelihoods for Resilience learning activity in Ethiopia, which is in the highlands. But I think the mission there was very adamant that they wanted to see a relatively reliable treatment and control group. For those of you who know Ethiopia, the diversity of livelihood zones, with the presence of the PSNP, community-based health insurance. For that impact evaluation, it was very, very important that we do the best job we possibly can in terms of delineating treatment and control on the information that's available. Certainly there are cost implications for it. But that was so important for an impact evaluation, right? Obviously for attributing change. And Tim, you can speak to this, what is sometimes a challenge is how do you distinguish that from analysis activities that are more focused on performance monitoring, right, as opposed to impact evaluation. So it's difficult to kind of do both under the same exercise, but it has sampling implications. Another thing I just wanted to
talk about that this afternoon.
Yeah. Another thing is just, I think, not to go too far in splitting hairs, but when we talk about comprehensive resilience programming, clearly the prime activity knew the context well that it was entering into and what those main drivers were in terms of natural resource management, access to financial services like livestock productivity. But I think in Uganda also we wanted to make sure that people weren't interpreting comprehensive resilience programming as sometimes it's done under DIFSAs and other activities, that you have to do everything that's needed in all places at all times. I think it's part of the resilience strategy, what we're trying to get better at is knowing which programs do what with which populations particularly effectively, and then how can you kind of coordinate across different activities.
back here?
I think also I just wanted to comment on the certain indicators or triggers need to be looked into, especially in a continuously changing environment, because what has happened in Chichika and those areas is because of the conflict, structural deterioration, and everything else, yes, the Western will go up. And what has happened is, if we look into we really need to have those indicators that can capture those changes that are happening, because sometimes we don't have that, and it may not give us the right understanding of what is happening in the context.
Right. No, I agree. In fact, that's a very good point. The context in which this impact evaluation was carried out has changed dramatically. Conflict has gone up dramatically in this area between the Borana and between the Somalis and the Borana. And so areas that they were programming in before have now become serious conflict areas. And so that has a huge effect on any of the gains that we saw from this program. All of 3 million people, 3.5 million people are displaced in Ethiopia now. So, you know, that also has big implications for the El-Farar project that you were just talking about. So, you know, we have to take this stuff seriously because it's happening everywhere. But I think that's why you have to understand resilience over time. And it's an evolving concept in a particular area where the context is evolving. What makes you resilient to a certain set of conditions? If the conditions completely change, you may not be resilient to the next set of conditions. Okay, so yeah. Maya?
No, it's a question from online.
Oh, okay.
Whenever you are ready.
I made my point. Go ahead.
Okay, we have a question from Anne Swindale online. When you say people who participated in the PNRM interventions were better off, in the example of the enclosures, did participation mean that they were able to continue to access and use the resources that were being enclosed? Or if not, what did participation involve and how did that have a positive impact?
Yes. No,
Yes.
If they actually were engaged in the natural resource management activity, and you know, so they could still access the resources, but in a managed way, rather than kind of a ad hoc way, it made a big difference in terms of their own livelihoods. Yeah.
Participating did not have access.
But people that were just left out and were not participating in it, then it had a negative effect.
This is a really interesting question, and there's a lot of interesting conversation around this, so let's talk.
And when the report is finalized and released, will the instruments be made public as well so that folks can see those, like exactly the types of questions that delineate participation versus exposure? Okay.
Hi, Tim. I'm curious to know more about aspirations. You did touch on aspirations and how it contributes to building resilience. For the two locations, did the study observe any changes in aspirations in the face of the drought?
Yes.
Okay. And
so one of the things that I think would be very important for, and I don't know if the project actually captured this, Diana might know, or John, like, you know, if you're doing interventions and you actually are increasing people's aspirations and confidence because of the training that's being provided or because of the fact that new opportunities have been created for them, are we effectively trying to understand if certain interventions are doing a better job at doing that than others?
Yeah, I'm kidding.
I mean, I think it's on the sort of collective research agenda. I have no idea in Prime or the follow-ons, whether we or others are looking at that specifically, but.
That's a great question that we can follow up. Yeah.
Hi, Sarah from America Health Africa. So the question I have is particularly on the Borana. We work with them in a project to end emergency translation coding and child early enforcement. One of the ways we're doing it is going with clan elders. So we try to map their leadership, and the Borana have a very interesting council of elders,
Right,
very
right.
high level, and they cross part of Ethiopia and Kenya.
Right,
where we're
right,
working.
right.
So I was wondering, as far as the system level change, are we talking system in the sense that you are involving the official government? Or did you also involve Council of Elders, like the 5-year, which is already other Council of Elders?
So we didn't implement the project, we just evaluated
No,
it.
no, I'm just,
I
But-
mean, do you know if when they,
I think Diane might be able to answer this. I think they did involve the elders in any of the rangelands management interventions that they were proposing. You know, the clan structures and how the clan structures were involved in rangelands.
Yes, and we had we had local teams lead that. They knew the structures, they knew how to do it. And then, these were areas where, especially CARE, Mercy Corps, and the local partners, we had, so this was a consortium of 10 partners. Two of the partners were international, but everybody else was local or national. So we had those partners really lead those discussions. CARE was leading the NRM part of the portfolio.
did you feel that actually when you're working with clan, especially in like country like either Ethiopia or Kenya, where the clan structures, people actually value that clan more than they value the authority, etc.
Yes.
Did you feel like working through clan leadership, it has shown better results than working with people that doesn't have the clan? But I'm thinking more about.
We never looked at it that way, to be honest.
Mhm.
I am assuming that was the direction that we were taking when we were looking at the interim structures, because the interim structures, we had local authorities coming in as well, but we also had clans. We had local traditional weather forecasters, so with the national system as well. And we also worked with the land program, which was also led by a different NGO, and they were trying to look at regulations at different levels as well. So, in terms of layering and sequencing, we were trying to work as much as possible with them also as how the new national strategy was fitting into these local systems as well. I think I heard that there was another question about aspirations and whether we were tracking
I
them.
make a follow-up, maybe question to your comment as well. This is to you, Tim, as well. In terms, you mentioned in the previous presentation and this one, the importance of social capital. And that came across very clearly in one of your slides between the adaptive, absorptive, and transformative capacities for resilience. And just following on the previous question, what is your view on the role of traditional and cultural practices in mitigation elements for resilience? It seems that in some cases maybe we're tending to overlook this and not get the fully engagement and participation. The particular example you gave of the natural resource management passes the typical case where if you don't have full ownership by local communities,
Right.
it's not going to be sustainable or succeed.
Absolutely.
So I think in terms of mitigating risks to resilience going forward, I think it's critical that in our programming and design, that where it's relevant, that local actors are fully engaged in the process.
Right.
And building on that, that comes then back to the other key element you mentioned in terms of systems, was the relationship with either governments or local government,
Right.
and how they maybe should be brought into the equation to play a bigger role, more in the facilitating and enabling element, but in provision of services, they need to be really equally part of the equation, I think,
Exactly.
to reduce the impacts
Exactly.
of
And I
shocks.
think several people have emphasized the importance of the social structure, understanding the existing social structures that are operating these areas, not only in terms of their contribution to social capital and governance. And I think Borana is a great case of that, where they are very hierarchically oriented in the way that they make decisions. And so if you get all of those hierarchies on board, you actually can do quite a bit. So I think that's something we need to do a better job at.
And it can come back to, if you tackle it on the systems approach, as you mentioned in the last presentation, if you get regional governments working at that level with traditional type of systems that have been proved to be effective over generations,
Right.
you might be able to, because all the shocks are not necessarily isolated, they're usually geographically spread. So
Right.
you have to deal with these shocks also in terms of, you know, the landscape utilization and how you react to it.
Right. And just one last point about this Borana connection with Kenya. A lot of the people that were struggling with the drought on the Ethiopian side went across because they already had family connections on that side. And so that cross-border responses were critical there in terms of understanding how people were adapting and you know, if Kenya is trying to block those people from coming across, it's a problem.
Actually created more, like another shock in reaction because the Borana and the Gabra took land that live in that border. And they're always fighting for land, for pasture. So the fact that at that point, all the Borana came from the other side of Patrick.
That's when that- that's
we
what
are
the-
being invaded, like it's basically the imbalancing this whole power thing that we had going on. So more fights start happening.
Yeah, yeah.
And I would just encourage, once again, I think this is a really interesting point. Again, going back to what was presented in Uganda on some research carried out by DAI and in South Sudan. Really, really interesting in the context of conflict and given the strength of social structures there. How are they kind of working together to develop what they refer to as some resilience profiles based on those driving factors that were very context specific. So yes, we need to learn much more and get better at it, and this is worth looking at. I think that presentation is available on the website as well.
Did you say one other aspiration question? No?
I don't know if there were some aspiration questions on whether we were trying to monitor.
Somebody aspiring to ask a question over there? Oh, there's one.
On the aspiration, I'm just looking at what has happened in Ethiopia because I'm from Ethiopia, and yes, with the major conflicts and major shocks, the aspiration level goes very low, and so that's just looking into that. But I was also thinking of informal systems that work. You know, there's the formal system, and then there's the local system. And then there's also an informal system where informal systems actually work better, especially when when the structure is failing, and that is the time when you work through those informal systems. But regarding the question from whether the plan system or the government system works, I think for Ethiopia the plan has worked negatively instead of positively, because that was actually one of the causes for conflict in the Jijiga zone. And so we have to be very careful at when and how and when to actually relate and intervene.
Okay. Should we take a break?
Yeah.
Have a question? I have a question here.
Yeah.
Measurement one. I would like you to comment a little bit more about how you arrived at the conclusion that participation in multiple activities had a larger impact. Did you do did you identify partial effects or interactive effects or nonlinear analysis of pathways? How do you come to that?
Well, we had a lot of questions that we added to the inline questionnaire to try to capture whether people were participating or not. We also added a lot of questions in the community questionnaire to try to get at systems level activities in those communities or cabellis. And so we can share those with you if you're interested in how we tried to capture that.
I think what he's asking though is less of like, was it just a pure count, like 0 to 4? Or is there a way, when you're trying to look at those things, of how did they come together? Or what was what were your tests that you ran on those? That's what
Well, we had these intervention clusters, you know, the 4 intervention clusters, and under each major heading, there were multiple interventions that were going on, and so it was a count. We would ask, you know, did you participate in using veterinary services? Did you, were you engaged in using the financial services? Are you involved in the BSLA? You know, we would ask that, and then it was a count.
So my question was actually very much aligned with that one, which was based on your
analysis of impacts of the different clusters of programming. It seems like a couple of them were much stronger. The livelihoods, livestock, productivity, and CCA.
Right, right.
So in the way that the control and the treatment were assigned, right, it was just a basic 3 or 4, your treatment, 0 to 2, your control.
Right.
But I could see a situation where if you're participating in the livelihood, productivity, and CCA, you might be better off or have see better results than if you're participating in natural resource management and the other 3 there. And so did you do any analysis in terms of seeing whether, let's say, the livelihoods productivity had as much or equal predictive power as including the treatment as all 3?
We did do that analysis. We can talk about it in more detail